Greetings to everyone listening to me. I am Martin Ayim, born in Winjin village in Azam clan, Widikum, Ate. Yes, I am the same person who played football with PWD Bamenda and attended the nursing school Bamenda for both the brevet and diploma programs. I played for the Cameroon junior national team in 1973. I also worked at the Provincial Delegation of Health, Preventive Medicines, Bamenda, also at Ngoa Hospital and Ndu Health Center. I coached Ndu Challengers to their first provincial championship and Interpol's competition in 1980. I attended Indiana University, Bloomington, Indiana, and Texas A&M University, College Station, Texas. Currently, I am an endowed professor of health education at Grambling State University, Louisiana, in the USA. I am also the executive director of Minority Health Promotion Initiative, Incorporated, a non-profit organization for disease prevention, and now developing a new program of scholarship to orphans of victims of communicable diseases. I am pleased to present my new book to the public, to everyone. This book is titled Communicable Diseases for School and Community Health Promotion. This book is receiving positive review from scholars and professionals internationally. I'm talking about South Africa, Nigeria, Iran, Cameroon, Eritrea, UK, and USA. The focus of this book is education about and the prevention of communicable diseases. I have discussed 132 communicable diseases in ways to benefit any person reading the book. I strongly recommend this book for adoption and for use in secondary schools, colleges, and universities as a first step towards primary prevention and education of the mind. Knowledge is power. This book has unique features combined. Start with the discussion of principles of infectious disease epidemiology, definition and clarification of terms are found in concepts, and concepts are found in chapter 1. Immunization and types of immunization, rates and ratios with formulae for calculations, discusses viruses and viral infections, bacteria and bacterial infections, fungi and fungal infections, metazoa and metazoal infections, or the worms. Each of the 132 communicable diseases is described under 10 headings. All the diseases are classified by infectious agent and mode of transmission, that is to say, viral diseases transmitted by da-da-da-da. Each chapter has links for further research. Each chapter has questions for discussion and revision for exams, for those preparing for exams. Remember, I said the book appeals to all and sundry. 20 chapters are grouped into 7 sections. The sectional bibliography, a subject index that one can easily look at a subject. Say you want to talk about measles, you want to find out information about measles, you look at subject index, go to M, see measles, it takes you back to the page, and you can find out more information about measles. The book is easy to understand. Now, the question is there any need for this book? I would say yes, there is a need. According to the World Health Organization, 17 million deaths occur yearly from communicable diseases. There is no primary prevention through a comprehensive school health education curriculum in developing countries, and in Cameroon in specific, starting from kindergarten. Now, continuing with the need, HIV/AIDS is killing our youth across the board in every country, every day. Swine flu, which is the H1N1 virus, has swept across South America, the USA, and the world with over 4,000 dead. Cholera is resurging. It's currently killing people in Cameroon and West Africa. Malaria is ever present in the tropics. Tuberculosis, sleeping sickness are common. Intestinal parasites, worms, are very much present. Because of these deaths among youth, the old are burying the young, a reversal of trend when the young should be burying the old. Lack of education being at the root is a real motivation for my writing this book on communicable diseases, for school and community health promotion to start a curriculum-oriented journey to address the problem. I emphasize curriculum-oriented journey related to health education and health promotion in schools within the framework of comprehensive school health education. I must at this point express appreciation to non-profit organizations, foundations, governments, researchers, the World Health Organization for the work done so far related to disease prevention. My contribution is different for developing countries. It is curriculum oriented. While in nursing school Bamenda, we had a community outreach session in 1979, and I remember how difficult it was in Bambui to convince locals that worms are not part of the gastrointestinal tract of the body. From then, I made up my mind to set out to where I am, USA, and to do what I have started doing, write books, to start a curriculum to address the health education problem in developing countries in a culture appropriate, age appropriate, and readability appropriate manner. I strongly believe that health education messages must be tailored in cognizance of cultural values. I feel it is time to take health education to our schools as part of the curriculum. Someone out there should advocate for governments to adopt this book and make it mandatory for schools and professional institutions, community health programs, and universities in developing countries. There is need. Public health officials, I want to give you some specifics related to Cameroon, taking that as case in point. Public health officials in Cameroon say nearly 500 people died of cholera in August 9, 2011. And 13,000 cases were reported in the country in the year 2011. Now, Professor Jove Anze, the Director of Disease Control at the Ministry of Health, once told journalists that 9 of the country's 10 regions are affected by cholera and intestinal infection caused by ingestion of bacterial contaminated food or water. This was a report through the CNN by Tapong Ivo Tanka. Now, HIV/AIDS in Cameroon, I'm talking about 2009 as a year of reference. The population was 18.9 million. Now, people living with HIV/AIDS in 2009 was 610,000. Women aged 15 and above with HIV/AIDS, 320,000. Adult HIV prevalence, 5.3. AIDS deaths in 2009, 37,000. Orphans due to AIDS aged 10 to 17, 330,000. This is according to the Population Reference Bureau and UNAIDS, United Nations AIDS Program. Now, the need, talking about malaria. Results of research conducted in 2010 by Kimbi et al. In Moliko, Bomaka, and Boya areas showed overwhelming prevalence of malaria among Cameroonian school children. Now, talking about the total enrollment of 1,367 and 542 students were tested, there were 313 positive cases, giving us a percentage of 56.7% of our students in that research being positive for malaria. Tuberculosis. According to a research by Awa Ndukum, published in Veterinary Medicine International Journal 2010, in Cameroon, the current annual TB incidence of over 200 cases per 100,000 population has been estimated. But its control, as in most African countries, is hampered by unfavorable socioeconomic conditions. The interaction with the HIV epidemic and widespread of anti-TB drug existence. A strong positive linear relationship exists between TB and HIV/AIDS. TB is the most opportunistic disease of immunosuppressed individuals in the country and can occur at different stages in the course of HIV infection. Now, sleeping sickness. In the last 10 years, over 70% of reported cases occurring in the Democratic Republic of Congo were of sleeping sickness. In 2010, only the Democratic Republic of Congo declared over 500 new cases per year. Angola, Central African Republic, Chad, Sudan, and Uganda declared between 100 and 500 new cases per year. Countries such as Cameroon, Congo, Cote d'Ivoire, Equatorial Guinea, Gabon, Guinea, Malawi, Nigeria, United Republic of Tanzania, Zambia, and Zimbabwe are reporting fewer than 100 new cases per year. This is according to the World Health Organization fact sheets. Now, roundworms. A study was conducted in 1994. In a study carried out in 4 villages of Makenede subdivision in 1994 to find out the prevalence of schistosomiasis, that's bladder infection, and other intestinal hermit infections, worm infections, among senior primary school children in Cameroon by Akofungwe, Oworere, Titanji, and Okrosa are published in the Journal of Herminthal Journal. They found out that infectious rates with intestinal parasites, worms, were very high, up to 98% in some villages. That prevalence rates of schistosomiasis, bladder infection, varied significantly between villages, with the highest 36.2% recorded in Makenene. This was published in the Applied Parasitology Unit, University of Jos, in Nigeria. Now, roundworm studies in 2000. Now, in a study conducted by Simon Brooker, Christel Donnelly, and Helen Guyot, reported in the Bulletin of the World Health Organization in 2000, estimate of the prevalence of roundworms infection using data obtained from school children alone showed 46.2% rate of infection in Cameroon. That same study reported 53.4% infectious rate for wigworm, 14.7% hookworm infections, 9.5% for bladder infection, and 5.7% for Schistosoma mansoni. This is according to the Bulletin of the World Health Organization 2000, edition 78, page 12. Now, to buttress my journey, my belief is seriously motivated by by professionals and their wise sayings which help to motivate me. My professional philosophy, thus, the aim of education must be the training of independently acting and thinking individuals who, however, see in the service to the community their highest life problem. That's Einstein. I love that a lot. And according to Judge Bernard Shaw, you see things and you say why, but I dream things that never were, and I say, why not? Now, George Washington Carver, where there is no vision, there's no hope. And Albert Gorky, a Russian, research is to see what everyone has seen and think what no one has thought. Now, my serenity prayer, I believe in this so much, that God grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. It's a quote by Reinhold Niebuhr. Yes, certain things and some people you cannot change, no matter what you do. Leave them alone and move on. Nickelbacker once sang that a bended tree cannot be straightened. If you want to force it, it will Wellinger. That was a good message, good rhythm, not so good English anyway, but powerful. Now, I've talked about comprehensive school health education. The question is, what is comprehensive school health education? What do I mean by starting a journey of developing a curriculum, health education, health promotion curriculum, in schools in developing countries, starting from kindergarten, within the framework of comprehensive school health education? What really do I mean? Comprehensive school health education is the framework for teaching health education and health promotion in schools from kindergarten. We have to start somewhere to address this problem holistically through a comprehensive school health education curriculum from kindergarten through secondary schools. Health education and health promotion should be a subject at GCE ordinary level. I recommend that comprehensive school health education in developing countries should have two core content areas to address a variety of holistic health needs and concerns. These content areas are: 1, communicable diseases education and prevention; 2, personal and community health education and prevention. This has to do with education and prevention of non-communicable diseases. Because we have incidents of cardiovascular disease, heart disease, cancer out there, we have to have a curriculum that also addresses disease of lifestyle, all these chronic conditions. In that way, we're giving our children holistic knowledge from communicable disease standpoint and non-communicable disease standpoint. Comprehensive school health education should have a sequence and scope and progress from general concepts to specifics with goals and objectives as students move on from one grade to another. Now, at high school and university level, at high school education, health education and health promotion should be taught as a subject, GCE advanced level. At university and schools of public health, there should be degree programs for health education and health promotion in community health departments at BS, Master's, and PhD levels with school health education and community health promotion specializations. Graduates from these programs are then professionals in health education and health promotion. Until then, you are not a graduate, you're not a professional in health education and health promotion. Now, upon graduation with a BS, Master's, MS, or PhD from accredited programs as professionals, they seek certification as certified health education specialists in line with international expectations by the National Commission for Health Education Credentialing, Incorporated, in Czech, NCHEC, in the USA. They earn the CHES, Certified Health Education Specialist certification for those holding BS degrees, and the Master Certified Health Education Specialist for those having a Master's and a PhD degrees, Master's or PhD degrees. Now, the question is, do I have any expertise? I am throwing all these things out there. Can I get them done? The answer is yes. I have experience. I have sound academic preparation at Indiana University, Bloomington, Indiana, and Texas A&M University, College Station, Texas. I have 20 years of teaching health promotion at Grambling State University. I built a successful health promotion curriculum in the university. I have served on the Louisiana State Task Force for grade level expectations for health education. I have won awards of community service in the USA. I have leadership positions in professional organizations. I have conducted community outreach projects through federal grants in the USA successfully. I am nationally certified as an MCHES, Master Certified Health Education Specialist in Health Education and Health Promotion. I am the Executive Director, Minority Health Promotion Initiative, Incorporated, that is www.minorityhealthpromotion.com, a community service, non-profit organization, non-governmental organization that benefits communicable disease projects in underserved areas. I can serve effectively as a consultant in any country to get these programs going, to get health education and health promotion programs or curriculum within the framework of comprehensive school health education. I can provide that leadership. Now, what are the benefits of comprehensive school health education to a nation? Why should there be programs or a curriculum in health education and health promotion in developing countries within the framework of comprehensive school health education? The benefits are many to any country. There can be no economic development and progress when people are sick, when people are not well. So increased quality of life of citizens, increased life expectancy of the country, increased economic productivity, healthier populations, rise in GDP, increased national expenditure on health, or decreased national expenditure on health care, reduced mortality rates, high employment among youths. This program alone will have at least 10,000 youths will be employed if this program is implemented. More health literate population, better and more competitive athletes, intelligent minds result to happy, intelligent citizens. These and many others are the benefits of comprehensive school health education curriculum in any developing country. Case in point, Cameroon. My appeal to the National Book Adoption Committee: start a national journey with me to primary prevention in our schools by adopting this textbook in our nation's secondary schools, starting from Form 5, high schools, upper and lower safe, professional schools, schools of nursing, public and private, technical institutions, community health departments and universities to build BS, MS and PhD programs in health education and health promotion. Grambling State University, Louisiana, USA has adopted this book already. Let developing countries follow suit. I have calls from other countries indicating interest. I'm appealing to governments in developing countries because of the numerous benefits to the nation I have cited, and because there is a need, approve and fund a curriculum in health education and health promotion within the framework of comprehensive school health education in schools starting from kindergarten. 1,000 points of light. I believe in community service. I believe in giving. As we speak and as I address you, there are children suffering, there are children dying, there are orphans of victims of communicable diseases as we speak today. So I believe in this, that a candle loses nothing by lighting another candle. There are 330,000 orphans of victims of HIV/AIDS alone in Cameroon as of 2012. Therefore, the goal of my nonprofit is to provide humanitarian assistance in form of academic scholarships to as many orphans of victims of communicable diseases as I can. 10% of all sales, of all proceeds from this book will go to scholarship to orphans of victims of communicable diseases. You can donate generously through www.minorityhealthpromotion.com to this project alone. Your donations are welcome. In future, we will be launching scholarship program fundraising activities to supplement the proceeds of 10% that I am putting in for this program. In that way, we can reach out to many and help many orphans get an education. This is my call to everyone. My tax-exempt nonprofit organization is Minority Health Promotion Initiative. I've said it. And the webpage is www.minorityhealthpromotion.com. You can contact me at atanken2002@yahoo.com. That is ATAKYEN2002@yahoo.com. Atanken in Widekum means big papa, family person. And as a family person, I have to look and take care of the orphans or victims of communicable diseases. I am counting very much on public support in this direction. Now, thank you very much for listening. Thank you very much for support, and God bless you.